My name is Jackie Lovato, and I'll be talking to you today about generalized anxiety disorder. I chose anxiety disorders for this presentation because I'm interested in learning more about anxiety and the most effective treatment methods available. I've had extensive personal experience with anxiety disorders through friends and family who have fought it, as well as experiencing physical symptoms of anxiety myself. This is not surprising, as anxiety disorder is the most common type of psychological disorder, according to our text. By definition, anxiety is a natural and healthy apprehension to an anticipated problem. In contrast, fear is defined as a reaction to immediate danger. Both can be beneficial adaptive tools in that they help us deal with problems or threats. Fear causes changes in the nervous system to physically prepare our bodies into fight or flight reactivity. Anxiety creates awareness that helps us plan or prepare to deal with problems in the future. Disorders occur when there's an overabundance of anxiety, an increase in its duration and intensity, and often over minor things that become detrimental to our daily adaptive functioning. The DSM-5 outlines 5 different anxiety disorders: specific phobia, social anxiety disorder, panic disorder, agoraphobia, and generalized anxiety disorder. For this presentation, I'll be focused on generalized anxiety disorder. For each of the disorders, the same set of criteria must be present for a diagnosis to be made. They are that symptoms must interfere with important areas of functioning or cause marked distress. Symptoms persist for at least 6 months. Symptoms are not caused by a drug or medical condition, and the fears and anxieties are distinct from the symptoms of another disorder. The last 3 appear in the diagnostic criteria for many disorders defined in the DSM-5. They seem obvious but are important to notate. The symptoms for each anxiety disorder are unique and differentiate each diagnosis accordingly. The criteria for generalized anxiety disorder are excessive anxiety and worry at least half the time, and about a number of varying things, like social events or activities, family, money, etc. The anxiety or worry is hard to control, and the worry is associated with at least 3 of the following: restlessness or feeling on edge or keyed up, easily fatigued, difficulty concentrating, irritability, muscle tension, and sleep disturbance. The main feature of generalized anxiety disorder is worry. People with generalized anxiety disorder are constantly worried, fretting often about insignificant things. The worry is excessive, uncontrollable, and long-lasting. Effective assessment of generalized anxiety disorder includes a clinical interview with specific questions regarding the diagnostic criteria presented in the DSM-5. It is important to treat the clinical interview like a conversation, ensuring that clients feel heard and understood. Though not heavily weighted in CT, I believe the therapeutic relationship to be our strongest asset in any treatment, so it's crucial to display empathy and unconditional positive regard from the first session to the last. Administration of the DASS-21, or Depression, Anxiety, and Stress Scale, is also a beneficial part of the assessment, as it is an empirically researched and commonly used tool that has proven valuable in assessment. Because there is extensive research supporting cognitive therapy and its positive outcomes, and its low rate of relapse, I have chosen to focus on it here. CT is active, time-limited, present-centered, problem-oriented, collaborative, and structured. Therapists emphasize the client's active role in self-discovery, and this can be done in the very first session. We aim to address distorted and dysfunctional thoughts related to clients' anxiety by identifying, challenging, and then modifying their ideas about their stressors. We begin by gathering information about their stress and anxiety, then provide insight and education on natural and healthy responses. We work together to test the validity of those responses, the natural and healthy ones, versus their maladaptive thoughts and behaviors to stress previously used. Then we arm them with new problem-solving skills and tools that will help decrease their worry and increase their adaptive functioning with future stressors. Relaxation training has also proven effective in treating anxiety, where clients are taught to release their tension by tensing, then relaxing the muscles in the midst of imaginal or in vivo anxiety-provoking situations. This is also done with a focus on restructuring the client's thinking into more rational and functional beliefs. Cognitive therapy is focused on present problems, so with each session, we will address, examine, and evaluate current faulty thoughts and behaviors. Clients will learn to connect their ways of thinking and how it makes them act and feel. Throughout the course of treatment, we will educate clients on how to re-evaluate their faulty beliefs on their own so they can problem solve and reduce worry and anxiety effectively in the future. I believe that people struggle to settle on solutions, and this can often cause anxiety, and unfortunately for some, anxiety disorders. When people are educated, activated, and encouraged to examine their problems, thought processes, and behaviors, they can begin to problem solve and reduce anxiety on their own. The anxiety can become overwhelming when you're at it alone, but through the therapeutic relationship and engaged cognitive therapy, people are empowered to realize their capability of rising above their worries and effectively managing stress on their own. Because anxiety affects us all, even the friends and family of those suffering with the disorder, this will lead to a better quality of life for everyone.